Question 1. Case: a 56-year-old man with COPD presents with dyspnea and barrel chest. ABG, pH 7.32, PaCO 258, HCO 329. Question: which nursing intervention is most appropriate? A. Increase oxygen to 100%. B. Encourage pursed lip breathing. C. Place patient flat for comfort. D. Restrict fluids. Answer: B. Rationale: pursed lip breathing helps reduce CO2 retention and improve ventilation. Strategy tip: in COPD, avoid excessive oxygen, focus on ventilation improvement. Question 2. Case: an asthmatic patient reports wheezing after exercise, SpO2 92%. Question: which medication should be given first? A. Fluticasone. B. Monteliacast. C. Albuterol. D. Ipratropium. Answer: C. Rationale: albuterol is a short-acting beta agonist used for acute bronchospasm. Strategy tip: rescue medication equals albuterol, controller equals corticosteroid. Question 3. Case: post-abdominal surgery patient develops shallow breathing and fever 38.6 degrees Celsius. Question: what is the most likely complication? A. Atelectasis. B. Pneumonia. C. Pulmonary embolism. D. ARDS. Answer: A. Rationale: post-op hypoventilation leads to alveolar collapse, atelectasis. Strategy tip: encourage deep breathing and use incentive spirometry post-op. Question 4. Case: pneumonia patient becomes confused and restless. Question: what is the priority nursing action? A. Increase 4 fluids. B. Reassess oxygen saturation. C. Give acetaminophen. D. Perform chest physiotherapy. Answer: B. Rationale: confusion suggests hypoxia, reassess oxygenation immediately. Strategy tip: mental changes equals early sign of hypoxia. Question 5. Case: trauma patient shows paradoxical chest movement after a car accident. Question: which condition is indicated? A. Pneumothorax. B. Flail chest. C. Hemothorax. D. Pulmonary embolism. Answer: B. Rationale: opposite chest movement indicates flail chest. Strategy tip: flail chest equals paradoxical movement from multiple rib fractures. Question 6. Case: asthma patient on inhaled corticosteroids has white patches in the mouth. Question: what is the correct nursing action? A. Stop steroid. B. Report possible oral candidiasis. C. Increase fluid intake. D. Administer bronchodilator. Answer: B. Rationale: steroids can cause fungal infection. Strategy tip: teach to rinse mouth after using steroid inhaler. Question 7. Case: TB patient on isoniazid develops yellow scara. Question: what should the nurse do? A. Continue medication. B. Report to provider immediately. C. Encourage high-protein diet. D. Give vitamin B6. Answer: B. Rationale: jaundice indicates hepatotoxicity, medication should be stopped. Strategy tip: monitor liver function with TB therapy. Question 8. Case: mechanically ventilated patient shows increased peak inspiratory pressure and wheezing. Question: what should the nurse suspect? A. Mucus plug. B. Pulmonary edema. C. Pneumothorax. D. Disconnected tubing. Answer: A. Rationale: increased airway resistance suggests obstruction by mucus. Strategy tip: always assess tubing and airway before calling provider. Question 9. Case: central line inserted, patient develops sharp chest pain and SOB. Question: what should the nurse assess first? A. Blood pressure. B. Breath sounds. C. Temperature. D. Heart rhythm. Answer: B. Rationale: absent breath sounds suggest pneumothorax. Strategy tip: sudden SOB after procedure, assess lungs first. Question 10. Case: tracheostomy tube dislodged 48 hours post-surgery. Question: what is the initial nursing action? A. Reinsert tube. B. Cover stoma and ventilate with bag valve mask. C. Call provider. D. Insert obturator. Answer: B. Rationale: early dislodgement can close airway, ventilate over stoma. Strategy tip: do not reinsert within 72 hours post-trach. Question 11. Case, COPD patient's SpO2 drops from 94% to 85% after O2 increased to 6 liters per minute. Question, what caused this? A. Anxiety. B. Oxygen toxicity. C. Loss of hypoxic drive. D. Hypoventilation. Answer, C. Rationale, high O2 suppresses respiratory drive in COPD. Strategy tip, maintain 1 to 3 liters per minute O2 in chronic CO2 retainers. Question 12. Case, ARDS patient has PaO2 52 mm of mercury despite 100% oxygen. Question, what does this finding indicate? A. Oxygen toxicity. B. Refractory hypoxemia. C. Hypoventilation. D. Pulmonary embolism. Answer, B. Rationale, refractory hypoxemia equals hallmark of ARDS. Strategy tip, PaO2 remains low despite high FiO2 in ARDS. Question 13. Case, post-lobectomy patient drains 150 milliliters per hour of bright red blood from chest tube. Question, what is the priority? A. Continue monitoring. B. Notify provider. C. Milk the tubing. D. Lower drainage system. Answer, B. Rationale, drainage greater than 100 milliliters per hour indicates hemorrhage. Strategy tip, report rapid bright red drainage immediately. Question 14. Case, patient has orthopnea, frothy pink sputum, and crackles. Question, what condition is most likely? A. COPD. B. Pulmonary edema. C. Pneumonia. D. Bronchitis. Answer, B. Rationale, pink frothy sputum equals pulmonary edema. Strategy tip, left heart failure pulmonary congestion. Question 15. Case, post-op patient on opioids has RR8 per minute. Question, what should the nurse do first? A. Apply oxygen. B. Administer naloxone. C. Increase 4 fluids. D. Place patient supine. Answer, B. Rationale, naloxone reverses opioid-induced respiratory depression. Strategy tip, RR less than 10 in opioid user equals give naloxone. Question 16. Case, 24-year-old cystic fibrosis patient has fever and productive cough. Question, what should the nurse prioritize? A. Encourage high-calorie meals. B. Perform airway clearance therapy. C. Limit activity. D. Increase steroid dose. Answer, B. Rationale, airway clearance is vital in CF to remove secretions. Strategy tip, CF equals airway clearance plus antibiotics first. Question 17. Case, 72-year-old post-op client suddenly short of breath with pleuritic pain and calf swelling. Question, which condition is most likely? A. Pneumonia. B. Atelectasis. C. Pulmonary embolism. D. Pneumothorax. Answer, C. Rationale, post-op immobility and calf swelling suggest PE. Strategy tip. Dyspnea plus chest pain plus leg swelling equals suspect. Question 18. Case, sleep apnea patient overdosed on benzodiazepines, RR6 per minute. Question, what is the priority action? A. Encourage deep breathing. B. Administer flumazenol as ordered. C. Apply oxygen mask. D. Reposition airway. Answer, B. Rationale, flumazenol reverses benzodiazepine effects. Strategy tip, low RR from sedatives antidote and support airway. Question 19. Case, student nurse asks why TB patient must stay in negative pressure room. Question, best nurse response? A. To control moisture. B. To prevent spread of airborne organisms. C. To keep patient warm. D. To protect the patient from others. Answer, B. Rationale, negative pressure prevents airborne spread. Strategy tip, airborne precautions equals N95 plus negative pressure. Question 20. Case, asthma patient on continuous albuterol develops tremors and tachycardia. Question, what electrolyte imbalance is expected? A. Hyperkalemia. B. Hypokalemia. C. Hyponatremia. D. Hypercalcemia. Answer, B. Rationale, beta agonists drive potassium into cells. Strategy tip, monitor K levels and cardiac rhythm with albuterol. Question 21. Case, ARDS patient develops abdominal distension and low urine output after fluid resuscitation. Question, what complication is suspected? A. Fluid overload. B. Abdominal compartment syndrome. C. Hypovolemia. D. Metabolic alkalosis. Answer, B. Rationale, increased intra-abdominal pressure impairs breathing and perfusion. Strategy tip, monitor IO and abdominal pressure in ARDS. Question 22. Case, COPD patient with JVD and pedal edema. Question, what complication is indicated? A. Pneumonia. B. COR pulmonale. C. ARDS. D. Emphysema. Answer, B. Rationale, COR pulmonale equals right heart failure secondary to lung disease. Strategy tip, systemic congestion equals right-sided failure from COPD. Question 23. Case, ventilated patient develops sudden hypoxia, hypotension, and tracheal deviation. Question, what should the nurse do first? A. Check EKG. B. Notify provider for chest decompression. C. Increase VO2. D. Assess pulse oximetry. Answer, B. Rationale, signs indicate tension pneumothorax. Strategy tip, sudden deterioration plus deviation equals decompress immediately. Question 24. Case, infant with bronchiolitis has nasal flaring and SpO2 88%. Question, what is the initial nursing intervention? A. Give steroid. B. Suction nose and give humidified O2. C. Encourage feeding. D. Place prone. Answer, B. Rationale, clearing airway and oxygenation are priorities. Strategy tip, infants equal suction before oxygen for effective ventilation. Question 25. Case, patient with fever, cough, and dull percussion at right base. Question, which condition is suggested? A. Pleural effusion. B. Pneumothorax. C. Pulmonary embolism. D. Asthma. Answer, A. Rationale, dullness and decreased fremitus equals pleural fluid. Strategy tip, use percussion to distinguish effusion versus consolidation. Question 26. Case, a 35-year-old with a history of cystic fibrosis is admitted with dehydration and thick, sticky sputum. Question, which order should the nurse implement first? A. Collect sputum culture. B. Administer 4 fluids. C. Give bronchodilator. D. Start chest physiotherapy. Answer, B. Rationale, hydration helps thin secretions and improve airway clearance. Strategy tip, always correct dehydration before airway clearance in CF patients. Question 27. Case, a 42-year-old patient has tension pneumothorax after trauma. Trachea deviates to the left, and SpO2 is 78%. Question, what immediate intervention is expected? A. Chest tube insertion. B. Needle decompression. C. Bag valve mask ventilation. D. Intubation. Answer, B. Rationale, needle decompression relieves trapped air and restores lung expansion. Strategy tip, tracheal deviation plus distress emergency decompression first. Question 28. Case, post-thoracentesis patient suddenly complains of dyspnea and sharp chest pain. Question, what should the nurse suspect? A. Hemothorax. B. Pulmonary embolism. C. Pneumothorax. D. Atelectasis. Answer, C. Rationale, lung puncture after thoracentesis can cause pneumothorax. Strategy tip, always assess breath sounds post-procedure. Question 29. Case, patient with COPD is prescribed theophylline. Question, which finding requires immediate action? A. Restlessness and insomnia. B. HR-128 and vomiting. C. Mild headache. D. Occasional cough. Answer, B. Rationale, theophylline toxicity causes tachycardia and GI distress. Strategy tip, monitor serum levels, therapeutic range, 10 to 20 g/ml. Question 30. Case, a 60-year-old male presents with chronic cough, weight loss, and blood-tinged sputum. Question, what diagnostic test confirms the suspected condition? A. Chest X-ray. B. CT scan. C. Sputum cytology. D. Pulmonary function test. Answer, C. Rationale, sputum cytology confirms lung cancer by identifying malignant cells. Strategy tip, persistent cough plus hemoptysis equals suspect malignancy. Question 31. Case, patient with pneumonia on 4 antibiotics develops watery diarrhea. Question, which organism should the nurse suspect? A. Candida albicans. B. Pseudomonas aeruginosa. C. Clostridioides difficile. D. MRSA. Answer, C. Rationale: antibiotic use can cause C. difficile infection. Strategy tip: always assess stool patterns with antibiotic therapy. Question 32. Case: postoperative patient has SpO2 86% on 4 liters per minute nasal cannula and RR 32. Question: what should the nurse do next? A. Increase O2 to 6 liters per minute. B. Switch to a Venturi mask. C. Encourage incentive spirometry. D. Notify provider. Answer, B. Rationale: Venturi mask provides precise FiO2 for better oxygen control. Strategy tip: when oxygen needs exceed nasal cannula, use Venturi or non-rebreather. Question 33. Case: patient with pleural effusion complains of dyspnea on exertion. Question: which nursing assessment best evaluates improvement? A. Weight changes. B. Breath sounds. C. Sputum color. D. Heart rate. Answer, B. Rationale: resolution of effusion equals improved breath sounds and less dullness. Strategy tip: auscultation shows recovery before imaging confirms it. Question 34. Case: COPD patient develops thick mucus, difficulty expectorating, and dry mouth. Question: which nursing intervention is most appropriate? A. Restrict fluids. B. Encourage fluid intake. C. Administer diuretics. D. Give cough suppressant. Answer, B. Rationale: hydration thins mucus, promoting airway clearance. Strategy tip: fluids are critical in secretion management for COPD. Question 35. Case: patient with pneumonia is receiving 4 fluids and antibiotics. Now has fine crackles and JVD. Question: what complication is suspected? A. Fluid overload. B. Worsening pneumonia. C. Pleural effusion. D. Sepsis. Answer, A. Rationale: crackles and JVD indicate fluid overload. Strategy tip: monitor input-output and lung sounds closely in IV therapy. Question 36. Case: patient with severe asthma attack is not responding to albuterol. Question: what additional medication may be indicated? A. Salmeterol. B. Epinephrine. C. Prednisone. D. Cromolyn. Answer, B. Rationale: epinephrine provides rapid bronchodilation when beta agonists fail. Strategy tip: status asthmaticus equals epinephrine or 4 corticosteroids. Question 37. Case: client with lung cancer on chemotherapy reports shortness of breath and anxiety. SpO2 84% on room air. Question: which oxygen delivery method is most appropriate? A. Nasal cannula. B. Simple mask. C. Non-rebreather mask. D. Venturi mask. Answer, C. Rationale: non-rebreather delivers high concentration O2 in severe hypoxia. Strategy tip: non-rebreather equals emergency O2 support until ABG stabilize. Question 38. Case: patient with bacterial pneumonia is started on 4 antibiotics. Question: which nursing action prevents spread of infection? A. Use airborne precautions. B. Use droplet precautions. C. Use contact precautions. D. Use standard precautions only. Answer, B. Rationale: pneumonia spreads through droplets. Strategy tip: droplet equals surgical mask, not N95. Question 39. Case: patient post-thoracotomy complains of severe pain with breathing and shallow respirations. Question: which is the nurse's priority action? A. Encourage ambulation. B. Administer prescribed analgesic. C. Increase fluid intake. D. Assess incision. Answer, B. Rationale: pain control prevents hypoventilation and atelectasis. Strategy tip: manage pain before respiratory exercises post-thoracotomy. Question 40. Case: post-laryngectomy patient communicates by mouthing words. Question: what communication aid is best to introduce? A. Flashcards. B. Writing board. C. Speaking valve. D. Picture chart. Answer, C. Rationale: speaking valve allows voice use after tracheostomy or laryngectomy. Strategy tip: restore communication to reduce anxiety post-surgery. Question 41. Case: patient admitted with acute respiratory distress has frothy pink sputum and rales. Question: which medication should be given first? A. Furosemide. B. Morphine. C. Nitroglycerin. D. Albuterol. Answer, A. Rationale: furosemide reduces pulmonary congestion rapidly. Strategy tip: in pulmonary edema, sit upright, give diuretic, oxygen. Question 42. Case: asthma patient reports chest tightness, but no wheezing is heard. Question: what does this indicate? A. Airway clearing. B. Complete airway obstruction. C. Mild asthma. D. Medication effect. Answer, B. Rationale: no air movement means severe obstruction, impending respiratory failure. Strategy tip: silent chest equals emergency intervention required. Question 43. Case: ventilated patient has PaCO2 25 mmHg and RR 30 per minute. Question: what adjustment is most likely needed? A. Increase rate. B. Decrease tidal volume. C. Decrease rate. D. Increase FiO2. Answer, C. Rationale: low CO2 indicates hyperventilation, rate should be reduced. Strategy tip: ABG interpretation guides ventilator settings. Question 44. Case: patient with pneumonia is receiving oxygen via nasal cannula but remains hypoxic. Question: what is the next appropriate step? A. Apply non-rebreather mask. B. Intubate immediately. C. Call respiratory therapist. D. Encourage deep breathing. Answer, A. Rationale: escalate oxygen delivery before advanced airway. Strategy tip: always progress from least to most invasive oxygen methods. Question 45. Case: a client with COPD reports increased sputum, fever, and fatigue. Question: which lab test best monitors for infection? A. CBC. B. ABG. C. Serum sodium. D. Sputum cytology. Answer, A. Rationale: elevated WBC count indicates infection. Strategy tip: baseline CBC helps track pneumonia or COPD exacerbation. Question 46. Case: patient receiving continuous oxygen therapy develops dry nasal mucosa. Question: what nursing action prevents further irritation? A. Decrease flow rate. B. Use a humidifier. C. Stop therapy intermittently. D. Switch to mouth breathing. Answer, B. Rationale: humidification prevents drying of mucosa. Strategy tip: humidify O2 greater than or equal to 4 liters per minute flow rate. Question 47. Case: patient after thoracic surgery has continuous bubbling in the water seal chamber. Question: what should the nurse suspect? A. Normal drainage. B. Air leak. C. Blocked tubing. D. System clog. Answer, B. Rationale: continuous bubbling equals air leak in system. Strategy tip: intermittent bubbling is normal, continuous means leak. Question 48. Case: patient develops sudden shortness of breath after central line removal. Question: what is the priority intervention? A. Call code blue. B. Apply pressure dressing. C. Place in Trendelenburg and left lateral position. D. Start oxygen. Answer, C. Rationale: prevents air embolism from entering pulmonary circulation. Strategy tip: Trendelenburg plus left side traps air in right atrium. Question 49. Case: COPD patient reports sleeping upright and using multiple pillows. Question: what is this finding called? A. Orthopnea. B. Dyspnea. C. Platypnea. D. Apnea. Answer, A. Rationale: orthopnea equals difficulty breathing while lying flat. Strategy tip: common in COPD and heart failure. Question 50. Case: patient admitted with sepsis develops increasing dyspnea, crackles, and PaO2 55 despite oxygen therapy. Question: what syndrome is likely developing? A. Asthma. B. ARDS. C. COPD. D. Bronchitis. Answer, B. Rationale: ARDS follows sepsis and manifests with refractory hypoxemia. Strategy tip: sepsis plus low PaO2 equals early sign of ARDS, escalate to ventilatory support. Thanks for watching. If you found this video helpful, please like, subscribe, and share it with a fellow nurse. Remember, great nurses think critically, not just clinically. Keep learning, keep practicing, and I'll see you in the next video. This is Nclex Made Easy 91, where knowledge meets care.